I was a regimental medical officer to one infantry battalion. We call it RMO. This infantry battalion duty was to safeguard in somewhere near Sikkim China border. Every battalion has to go on some exercises. They go away from their unit in a very dangerous situations, dangerous conditions, because in case of war, you have to do the same thing. I remember very important day. I know my commanding officer, Colonel R.V. Akholkar. He was my commanding officer. He used to call me, "You are not my doctor, you are my commando," because that is the first infantry unit in high altitude. I joined with them. And then we went on an exercise. We walked throughout the night in 10 feet snow, and feet are digging into the snow, coming up. We reached one place where we had bunkers, and also in the winter time what happens? All these shepherds and yak shepherds, all these people, they have their yak huts. They store their food, everything for animals in the winter, and they go away. Actually, these are all free. So army units, when they go on these exercise programs or long schemes, they do use these places. So we stayed in that yak hut, and then you know how army functions. Our mess commander came, nicely gave hot omelets, roti, rice, whatever it is. We had hot food. Morning we are supposed to conduct a attack on a mock attack. It's a drill training program. And during this exercise, we had a strange experience. We went on an attack. Then we are coming down. We are all exhausted because there was almost 15 feet snow, chilly winds, and everybody had their own luggage. You know, a kind of a simulation like a war scenario. So what happened when you were coming down? Myself and my CO, Colonel R.V. Akholkar, and other officers, we were all walking. And then from a far distance, I saw one man, one soldier. He was slowly swinging and walking. Then I saw something is wrong with him. Is he not well, or is getting any heart trouble or anything? So I didn't know, but still, then I told CO, "Sir, let me walk a little bit faster." I gave my bag to somebody, and then I walked fast. You know, walking in high altitude is so difficult. A lot of pressure because there is no oxygen concentration in the air, and it is cold, and you have a lot of luggage on your body. I walked with a greater difficulty. By the time I reached him, he slowly collapsed. It's a marvelous experience. All my senses, what we learned in Gandhi Medical College and Gandhi Hospital and during my clinical practice before I joined army, they all came into action. They were churning my brain. What happened? He was sweating and his eyes are becoming, out of shape. He's looking like a dying man. I also thought, and he's a young boy, so I thought he won't have any heart disease because they're all fit soldiers. And then I recall in a 2 kilometers distance, there is another battalion with their own doctor and then medical unit should be there. So what I did, I called another 2 soldiers. Walking only difficult, with a great difficulty, we carried on him and then carried to that MI room. Luckily, when I called the local RMO there in that unit, they're also in high altitude. He was known to me because he was in military hospital Secunderabad. Then my diagnostic capability really helped me. I said he's going into hypoglycemia. Obviously, you walk many kilometers and not with much of food, and your sugars in the blood, when they drop below 70 or 60, then brain does not get sugar supply, then you go into hypoglycemia. This is a very serious problem because in acute hypoglycemia, brain stem can get injured and then people may go into coma. First I said, forget about whatever it is. You bring dextrose around 25 ml or 50 ml, give ampules. I broke fatafat, pushed into his veins. And he was asking me, "Arey Choudhary, you're just giving sugar, we don't know what it is." I said, "You just forget about it. I am sure it is hypoglycemia." That was a very, very decisive moments of life and death for the soldier. I gave intravenous dextrose and he slowly opened eyes. Sarji, Ram Ram, he said. I said, thank God, I saved you. And my CEO was watching the whole drama. He said, Chow, I will give you one beautiful table and chair for your clinic. I will give from regimental fund this gift for you. I said, it's okay, sir. I am happy that I saved that soldier without anything. Thanks to that RMO and that unit who was nearby. But my friends, decision making is very, very important. I appreciate myself then for making the decision of diagnosing him as hypoglycemia, that is a low sugar in blood. Many times, remember this, I saved that soldier in those conditions, in a high altitude of 13,000 feet, where 15-20 feet of snow, hardly any oxygen, you already walked couple of days during exercise. You can save in ICU of any corporate hospital, but saving in that area. Then my CO wrote a commendation for me. You know the climax? That time, one brigade commander was there. I don't want to tell his name. He said, Colonel Akolkar, you are sending one recommendation for a Army Commander's Medal for this young doctor. But saving life is a duty, no? Why should we comment? That's how people think. But it doesn't matter. I did a lot of miraculous things like this in my life. I didn't get many awards, but saving life is more than Padma Vibhushan. So this is a story, dear friends. I'll keep sharing army stories, although I stayed in army for a short time, but I had a very illustrious moment in the army time. So I would be sharing more of these stories to you. Thank you for patient listening.